What is up, Sleep Tribe? Welcome to a brand new episode of the Healthy Sleep Revolution podcast. I am your host, Dr. Meghna Dasani, and enough about me. Today, I have a guest who we were just talking before we actually hit record, and it's like, we've met before, haven't we? How do I know you? Have you been to this conference? It's one of those human beings that you follow on social media and you just connect because your message is the same, your path is the same, your why is your same. So it is my pleasure to introduce you guys to Dr. Christopher Allen. He is a sleep MD. He's an actual sleep doctor, and you are also a pediatric neurologist, aren't you?
Yes, correct. And so I always loved neurology and being a pediatric neurologist, even during that training, I just fell in love with sleep medicine as well. And so I decided to do both. So I love neurology, but honestly, sleep medicine is my passion.
You're not an underachiever, are you? Oh, I was a neurologist. I just decided to do sleep medicine as well. Was there something that took you down that path?
Yeah, it's funny because I feel like that's where everything led me to going down paths, like even with neurology. Like for example, with the neurology, I just love how you can look at the body and figure out what part of the brain it comes from. That amazed me. And then a personal story, and I always tell this to my patients. I also tell it on my content as well, is that it makes me sound like a cheesy commercial, but I'm like, not only by your doctor. I have obstructive sleep apnea. So I've been treated for about 19 years. And then just seeing that and going to a rotation while I was in training for pediatric neurology, I was like, you know what? Being a personal CPAP user, seeing the effect of quality sleep, I want to make sure that my patients have that. And just the interactions I have with my patients, I love it. I can talk about sleep for hours. And the thing is that in the world, people will sacrifice sleep first. And so that what pushed me into sleep medicine. And I'm really glad that I'm a part of the sleep world.
I am too. Yes. Aren't we all guilty of that? Oh, I got to get to this because I have a kid that just went into college and I know she's already doing that. It's like, I have a project to finish. I'll work until midnight. And then she still has to wake up at 6 a.m. the following day. So we are all so guilty of that. I'm so excited that, go ahead.
I was going to say we all are. And the thing is that funny. I used to joke with my family. It's like, I don't know if I did sleep medicine for a cry for help because I was that person trying to stay up late. And then once you're in sleep, you're like, oh, productivity actually goes down when you stay up late. It's better to actually get the recommended amount of sleep. And so it's just putting that awareness out there. And, that's when you feel like you're working longer, it makes it feel like you're doing something more. But at the end of the day, it's about working smarter and getting that recharge, getting quality sleep.
Yes, wise words indeed. I hope our listeners are taking note. If you're a parent, know that it's okay to fuss at your child to make sure they're getting the sleep that they need.
Oh, yeah.
I was fascinated when I read that you have that background in neurology and the overlap into sleep, especially with our kids that suffer with ADD or ADHD. Where do you see that overlap happen? And let's dive a little bit into that and the impact that you see.
Well, I'm very fortunate to be a pediatric neurologist. And one thing I realized as soon as I finished my training for sleep medicine, it just enhanced me as a better neurologist. Because the thing is that even when I see patients that will come through in my neurology clinic, and for example, they're concerned for ADHD, but then the more I talk to them and more I examine them, it looks like there's concern for obstructive sleep apnea. And the effects of obstructive sleep apnea, especially in children, can mimic the effects of ADHD. And so, and true, you can have ADHD and obstructive sleep apnea, or it can be one or the other, but the more patients came into me for a neurology appointment, they end up getting a sleep study because they fit the bill for it. They had large tonsils. And then I'll ask them, like, does your child snore? Oh, yeah, I can hear them down the hallway. And then you look at their tonsils, they're very huge. And then you get to have that conversation with them to say that, you know what, we'll still work up ADHD, but we still need to look into their sleep to make sure they're getting quality sleep. And many times before, I've had many parents that'll say, thank you for looking at this. They're sleeping better. The teacher's saying that they're more focused. They didn't even start medicine for ADHD too, as well.
I don't hear too much of this from doctors or even patients that, come see us for the dental perspective. Is this because you have your dual training in sleep and neurology, or are these kids being screened for sleep before they're...
So I think it's a little bit of both, because I think my sleep training enhanced, and that's one of the things that you can talk to a lot of my colleagues with sleep medicine. it's one of the younger fields out there. And so people know of sleep medicine. Oh yeah, sleep apnea, CPAP, but it's more to that. And sometimes just the nuance of that, that's why I said it made me a better neurologist, because even being a neurologist, you say ADHD, yes, I know what to do and move forward with. And then because of my sleep fellowship, it made me look at the whole picture, ask about their sleep. And just even some of my colleagues, when they, hear about me, if I'm giving a lecture to them, and then they start, it's like, all right, okay, I know what you said about like obstructive sleep apnea and ADHD, and looking at that. And then there's either, in the world of sleep, there's other conditions as far as like restless leg syndrome. A lot of adults know about it, but it happens in children as well. And the thing is, the way that they talk about it, it's different than how an adult would talk about it. So, for example, they feel like their pants are on fire or there are ants in their pants, and they'll draw pictures and show like red on their legs to show like, hey, this is uncomfortable. And so treating that, helps for that. And even treating obstructive sleep apnea can help those symptoms as well.
That is amazing. Let's go down, since we've gone down this rabbit hole of what it could look like in children. What are the common symptoms? Yes, we all know about the snoring and not that it's unimportant, but some of these other ways in which kids can present with OSA, and parents might not be aware. So let's dive into that. What do you see? What do you recommend parents look for?
Right. And the thing is that, parents should look at their children, honestly, when they were little and they feel like they're very fussy because like they didn't get good sleep, that's where it is. And of course, it's like if they're snoring, if there's pausing and breathing, a lot of people know about that. But then also how they're sleeping, because are they sleeping with their mouth open? Are they sleeping with their neck arched? And when that's happening, that's, they're trying to create more airway to stop the obstructive sleep apnea from happening. And then also, if they're wetting the bed, those are things to look at as well. Also asking like, hey, do you have any headaches, as soon as you're waking up in the morning? Or are you, fussy, like you didn't have any sleep? And I usually in my clinic, I'll ask like, well, how's it at school? Are they tired during the daytime? Because usually when you are waking up, you should be alert during the daytime, especially getting a recommended amount of sleep. And so we look into that as well. So the biggest things I tell them to look for is how they're sleeping, watch them. If they're sleeping with their mouth open, neck arched, then they should talk to their provider to look into it more.
Yeah. And then like you mentioned, kids can have restless leg too. We're looking at getting a sleep evaluation if you're even considering an ADD or ADHD diagnosis, right? Like you mentioned, and I tell parents the same thing. We're not saying they don't have it. They might have it, but let's make sure we take sleep out of the picture.
Exactly. And the thing is, and I do that in my neurology office, especially if they're coming with symptoms of ADHD. And just because, if they have ADHD, usually look at the sleep, from it as well. And the thing is that even with obstructive sleep apnea, weight can play a role with children, but it's starting to become more of a phenomenon now, given like, the obesity epidemic. But with that being said, sometimes they might not even be obese and still have a form of obstructive sleep apnea. And the thing is that the severities is different than it is in kids and adults. Small kids, small airway. And so that's why like obesity really doesn't play a role. But the more, the older they get, and if they are they're very obese, then that can play a role as well.
Right. And is it true that in children we tend to see more hypopneas, right? We'll see more of the partial obstruction versus the complete?
Yes. And the thing is that it goes back to the small kids, small airways, and you'll see like that partial like decrease in breathing, or how, we put it in our textbook, when the decrease is more than 30%, when you see that, and they will wake up and then that's just chopping up their sleep. They're not getting quality sleep. And it doesn't necessarily mean that their oxygen will dip down. Normally for kids, your oxygen can go all the way down to 94%. If it goes below that, we need to figure out why is that happening. So it might be 90, and that's like considered not normal. So you have to look into it, even though it's still in the 90s. And so sometimes that won't even happen. Their oxygen still might be ranging like 94 or 95, but because of those hypopneas, they're not getting good quality sleep.
So do these, will sleep trackers work for kids? Is that something parents can consider before they actually go get a full-blown sleep study? What are your thoughts on that?
So sleep trackers, I think it still have a long way to go. It's really good to say if you are sleeping, and remember they're just basing it off of your heart rate, oxygen saturation to see how you're sleeping. But in the sleep lab, it's usually based off of electrical
There's so much
impulses
more,
from your
yes.
brain. Right. So the thing is that, well, I have the sleep tracker said that I'm in my REM sleep. It's really hard to say from that. And the studies that have shown like the effectiveness of it's really probably like within the 70 to 80%. So it's going in the right direction. I feel like in the sleep world, it'll be something that's useful. And for parents, I think it's a good way to look at like, okay, it says that you're moving around. Maybe we should look at this more, but I wouldn't solely just depend on that because if you see those symptoms, and even though their tracker's saying everything is well, but if you're visually seeing them snore or pausing and breathing or sleeping with their mouth open or frequently waking up overnight, even though the tracking app is saying something differently, still talk to your provider regarding that.
Correct. That's a great point because, in the practice, we have parents that constantly ask, we connect these dots with symptoms and what we see dentally, right? If I see
Oh yeah.
narrow arches and a tongue tie and all of that, a lot of parents hesitate with, let's send them to the sleep lab to get a sleep study for a child, which, as you know, you have everything attached, which gives us great information, but can be overwhelming for a child.
Oh yeah.
Which is where the question came from. Parents asking, can they use their Fitbit or their Apple Watch? Or, well, for adults, I even talk about the Oura Ring, but I don't know that Oura Ring is a great option for children.
Yeah.
Is that a good starting point? What would you encourage parents to do?
So the thing is that, if they have concern and they want to start with that, they, should start, with that. And the thing is that I see patients young and old because I'm very fortunate where I do pediatric sleep medicine, but I also do adult sleep medicine as well. And every age doesn't want to get a sleep study. So, just telling them like, look, it's like a bad night at a hotel, but it gives us the information that we need. And some of the stuff that, these devices are not able to do. And the thing is that I, reassure the family that like, hey, I know it might be, tough, but we get our information because honestly, we only need about 20% of that data to figure out where we need to go with it. So if they even feel like it's a bad night, we got more than enough information in there. The rest of it's just to enhance what we already know as well.
That is a great point. I have never thought of it this way, that all my sleep MDs need is just 20% of that data. So it could be, you've said it very well, a bad night in a hotel room, a comfortable hotel room, but nevertheless a bad night. So there's no expectations there, but it's going to give us the data that we need. I'm going to start using that with my, yeah, that's awesome. What is the youngest that you see and or treat children that have sleep issues? What's the youngest kid that you will see?
So I'm birthed to death. So if they're born, and the thing is that stages of sleep at different ages happen for, certain reasons. And the thing is that with children, one thing I love about even with sleep disorders is that time is on our side. They're going to get older. Their airway's going to open up more. Now that's barring other disorders like, if they have Down syndrome or if there's some, cerebral palsy or intellectual disability where they might, or where they have an increased rate of having a sleep disorder. But yeah, I see young and old. And because the thing is that there are different reasons why that could be happening, and there's different ways to treat that. So, I'm not going to put a CPAP on a 4-month-old, and there might be different ways that you might treating basing why it's actually happening.
Perfect time to segue into how are we going to treat these kids? Let's start with how are you going to treat that 4-month-old that finds their way to your practice and you determine, yes, they do have sleep apnea. What are the options? That's something even I am stumped because there's no teeth for me to expand.
Right. And so the thing is that, and that's the funny age. And that's why I would say time is on our side. And so I always talk to the family and it depends on the severity. So like say if they have mild obstructive sleep apnea, sometimes depending on where we're at, we might, watch and wait. If the oxygen saturation is not as significant, if their sleep quality is not as effective, I might do a watch and wait with them. And then if the case where it is, and then what we could use is oxygen therapy, because when they're that small, that little peep that happens can actually keep the airway open. And then, of course, oxygen keeps it up. I'll have some of my adult patients like, well, why can't I just do oxygen? I'm like, it's different reasons. I mean, if you're drowning underwater, oxygen like in your nose is not going to do anything. You got to fix the overall problem. When they get older, usually it's oxygen. And then that's when I can go to my ENT colleagues and going into adenotonsillectomy just to make sure. And it depends on the severity of but especially, in severe. And so usually what the process usually happens, if we do the testing and it does show obstructive sleep apnea, we look at the severity. If we do go towards treatment, like in the very young children, we'll do oxygen therapy. We'll try it from 6 months to a year to reassess because time is on our side. And so it might be mild, they grow, it's like, great, you can get out of it, because it's that sweet spot of age where it's hard to keep a nasal cannula on a child. And you're like, ugh. And also and we're specifically talking about obstructive sleep apnea because, I always joke, I'm a sleep doctor, not a sleep apnea doctor. It's a part of it because there's other disorders like central sleep apnea. So you always want to think about the root cause. And with central sleep apnea, it's like your brain forgetting to tell your body to breathe. And so with that, there's other ways that you can treat it. Sometimes it can be, oxygen or making sure that they don't have another disorder. And so that's where like my neurology background comes and help me along with that as well.
That is great. That is great. And the one other thing I do mention to patients is, let's see where the position of your tongue is, right? If there is a tongue tie, that's potentially falling back and contributing to the obstruction. So
Definitely.
whoever sees them, their pediatrician, pediatric dentist, ENT, easy fix, right? Especially in our infants.
Exactly. And then when they're getting older and they're younger children, then we're like, well, what's obstructing that airway? And like you said, if the tongue is going back, if the tonsils are too big. And the thing is that I usually give the ENT test because like, well, I went to this ENT doctor and they said my tonsils are fine. I was like, did they stick anything down your nose? It's like, no. And so like you have to look at the adenoids too, because sometimes the tonsils may not be enlarged, but the adenoids that I can't see unless you get a scope to see down there or imaging just to see how much is being obstructed. And so like there's, surgical ways, but then like I said, it's time. And usually once we have treatment, then my families will say, well, is it solved? Did we have resolution of this? And my answer to them is, I don't know. So what we usually do is do another test just to see if there has been resolution. And usually depending on the severity, like if it's mild and they did get any treatment, be that it's, getting an adenotonsillectomy or for a tongue tie or even rapid maxillary expansion, doing any of that. I see how they are doing clinically. And if it's mild and they say it's better, then I'm like, well, let's just see how we're doing and we can wait out a year and then get another test at that time. But usually if it's severe and then they get treated, then I do a test of cure just to make sure that it has been. Because if they are old enough, then you can start talking about CPAP therapy, because I do have pediatric patients that do use CPAP. And sometimes it's good and sometimes you have to build it up because it is something. I have to do that for adults as well. So yeah.
Right. Yeah, great. Lots of great options and opportunities here for parents to help their kids sleep better. As we start to wrap up, what are your top 3 tips for parents, for patients that are struggling with sleep? What are your top 3 tips for them?
Okay, so the first tip for families, consistency is key. So making sure that they have a consistent wake time and a consistent bedtime. I like to prioritize the wake time first because it's like, oh, we'll let them sleep in. Well, no, like having that consistency will help with their circadian rhythm, will help with them knowing that they have to go to bed, especially with children. And the thing is that if they're at an age for nap time, make sure to do that. The second tip is that making sure that they have a good environment to sleep. So making sure that there's no TV in there, or if there's a TV, make sure it's off, even if you have to unplug the plug. A lot of kids have tablets. Make sure the tablet's away so they can have that good sleep environment. That's going to help. And then finally, Mr. Sandman wants his money. And how do you pay Mr. Sandman? By sleeping. The thing is that if they're losing an hour, and it's like, oh, they'll just catch up on the weekend, then like on Friday, they have to add 5 extra hours, and no one's going to sleep their regular recommended amount of sleep and add 5 hours to it.
Correct. And I always like to tell parents this, there is always an answer. So if you are concerned about your child's sleep and you feel you're not getting the answers, get a second opinion, get a third opinion.
Exactly.
There's so many great resources like yourself that I'm assuming you would do telemedicine if patients needed to consult with you as well, right?
Oh, yes, definitely. It's in the works. I practice out of Michigan, Saginaw, Michigan, but we do have telehealth options. And stay tuned. I'm trying to cast my net even more. So
there we go. We have exciting news. We will have to have you back to share those news when it's a reality.
Oh, yeah.
How can our listeners connect with you? Where can they find you? How can they follow you? Share away.
Okay, so I do have I'm out in the social media world. I'm a sleep influencer as well. I was like, it's just a fancy way to say that I get to go on social media and talk about sleep. And so my handle is Sleep Dr. Chris. So Sleep Dr. Chris. I'm on Instagram. I'm on LinkedIn. I'm also on Facebook. I will be pushing into YouTube. So right now I do a lot of content on Instagram. I'm my genuine self on there. It's fun and there's tips for young and old. And it's funny, on Fridays I have a Q&A. So if you have any questions, shoot them my way. Then I answer them. So if you have any questions from that, again, it is Sleep Dr. Chris. And you'll like some of the videos. It's I'm a very unique person. Like I have like videos on there. You'll see me doing karaoke or dancing
Oh,
and all
and some
that.
dance moves. I've seen those videos with those dance moves.
Yeah,
So
and the
yes,
thing is that
very fun
also,
content.
yes, and you'll learn. And so and I love doing that. Like I said before earlier, sleep is my passion. And I love having an avenue where I can talk about what I love and making sure people get quality sleep because personally, I know how it feels when you don't get quality sleep.
And it's very obvious just in this conversation and everything that you post. For our listeners, we will have Dr. Chris's information, his Instagram handle, website, Facebook, whatever social media handles that we have in the show notes. So make sure you connect with him, you follow him, subscribe to all of the content that he puts out. Great value out there. But I want to say thank you for joining us today, taking time out of your busy schedule. And we hope to have you back when you have all those great new advances and new opportunities that you have coming up so you can share more with us. And good luck. Best of luck with all of that. I'm super excited for you.
Well, I appreciate that. And I just even appreciate you, me being on your podcast. Like I've listened to your podcast. It's a good hear. It's a good listen in the car. And so, yeah. And you strive and you've been some inspiration on things like, oh, maybe I could do that if she's doing that. So thank you for being an inspiration as well.
Well, thank you very much. Thank you guys. As always, make sure you subscribe, share this episode with somebody that you know could benefit from it. And I will see everybody next week.